Do you suffer with thyroid challenges? What are some of the symptoms of a low thyroid or hypothyroidism? Well, there's a lot of them. Do you feel tired during the day even after a good night's sleep? Are you fatigued and sluggish? Do you have difficulty losing weight no matter what you do? Do you gain weight very easily? Are you cold all the time, especially your hands and feet? Is your hair thinning out? Is it falling out? Do you have brittle nails, dry skin, constipation? Do you have any mood imbalances like brain fog, difficulty concentrating, memory loss, infertility issues, irregular periods, PMS? These are typical symptoms of a low thyroid. But here's the deal. 90% of thyroid problems is an autoimmune disorder called Hashimoto's. This is where your immune system is attacking your thyroid gland and destroying it over time. So it's not a thyroid gland problem per se, but it's an immune system problem. Now, the standard medical treatment to fix thyroid problems is to throw synthetic hormones at you like levothyroxine, Synthroid, maybe Cytomel, in an effort to balance your TSH. It's a blood marker for thyroid. TSH is not even a thyroid hormone, it's a pituitary hormone, and their treatment is always the same. To determine if you are having any problems with your thyroid, it takes a much bigger workup to determine thyroid function. So here you are walking around with all these symptoms, and the reason being is because you never address the root cause, the immune system. Now there's a quick test called TPO and antithyroglobulin antibodies that will tell us if it's your immune system or not. If you are one of the 90% of the people with autoimmune thyroid, you have to address your immune system. You have to address your gut because 80% of your immune system is in your gut. You have to take the stress and pressure off your immune system so the antibodies will stop attacking your thyroid gland. You may say, well, how do you do this? Well, we are going to look for things that is provoking your immune system that shouldn't be, like certain foods, hidden infections, toxins. Now, we do food sensitivity testing in the office, and one of our thyroid patients, who we diagnosed as having Hashimoto's, we did the test on her, and we found out that she was sensitive to gluten, dairy, soy, eggplant, peppers, peanuts, almonds, and bananas. We removed those things from her diet, and within 8 weeks she regained her energy. She was claiming she didn't have any energy during the day. She couldn't lose any weight. She lost 24 pounds. She said she was having brain fog. She couldn't think clearly. She could think more clearly, and she was even talking faster. And because she lost all that weight, her knee pain went away. She had a phenomenal result. Another thing I want to get across to you is a concept called molecular mimicry. This is where you eat a food that you're sensitive to, and those food molecules get into your bloodstream. Your immune system will memorize the molecular structure of that food, and it will attack it. But here's the thing. If there's any tissue in the body that mimics or resembles those food molecules, it will also attack that tissue. For example, we know that gluten and casein, which is a dairy protein, has the similar molecular structure as the thyroid. So when you eat these foods and you're sensitive to these foods, your immune system gets tricked and will attack the foods, but because it resembles thyroid tissue, it's going to also attack the thyroid gland, causing an autoimmune reaction. Does it not make sense to determine exactly how your immune system is reacting to foods that you shouldn't be eating? It's just common sense to me. So, we are not going to guess. We are going to food test and maybe run some other tests. We are going to dig deep to find the root cause of your problem. So if you're walking around with thyroid symptoms, give our office a call. Let's sit down. Let's go over your health history, your goals, and your concerns. And that will determine the best course of action to take. Should we run antibodies? Do you truly have a thyroid issue or an autoimmune issue? This will determine the path we take in terms of treatment. I want you to know that these conditions can be reversed and stopped through our all-natural, step-by-step plan that will truly bring you to optimal health in your life. So if this sounds interesting to you, give our office a call, 708-574-4018. If you have any questions, email me. I'd be happy to answer any questions. The email address is healthquest9443@gmail.com. And I hope you found this video informative, and thank you for watching, and have a great day.